Every day your heart beats over 100,000 times, pumping 2,000 gallons of blood through your body. It works 24 hours a day, 365 days a year. So it only makes sense that we should do everything we can to protect it. By following a few key lifestyle choices, we can significantly reduce our risk for heart attack and stroke. While you can't change some risk factors such as family history or age, there are some steps you can take to avoid heart disease. First, don't smoke or use tobacco products. Smoking is one of the most significant risk factors for developing heart disease. Even smokeless tobacco and low-tar or low-nicotine cigarettes are risky. Tobacco smoke contains nearly 5,000 chemicals that can damage your heart and blood vessels, making them more vulnerable to narrowing of the arteries, which can lead to a heart attack.
Smoking probably affects the risk of heart disease in many different ways. We know actually that smoking as few as 5 cigarettes per day doubles your risk of heart disease. So just a little bit is very harmful. The smoking itself affects blood cholesterol, for instance. It lowers the good cholesterol, which we recognize as a risk factor for heart disease. Smoking also increases the blood pressure a little bit, which adds stress and tension to the heart and the wall of the blood vessel. Secondhand smoke is very harmful, and in fact, in places where smoking has been banned in public places, we're starting to see a drop in heart attack rate in non-smokers.
Women who smoke and take birth control pills are at greater risk of having a heart attack or stroke than are those who don't do either. This risk increases with age, especially over 35.
Immediate benefits of quitting smoking are the blood pressure drops significantly. Also in time, generally a couple of months, you can see benefits to the cholesterol with a rise in the good cholesterol, which really protects the heart. The other good news is that by 1 year after quitting smoking, the risk of heart attack drops by about 50% in people who used to smoke.
The next step is getting active. Moderate physical activity can reduce your risk of fatal heart disease. Physical activity helps you control your weight and can reduce your chances of developing other conditions that may put a strain on your heart, such as high blood pressure, high cholesterol, and diabetes. It also reduces stress, which may also be a factor in heart disease.
Aerobic exercise is probably the best way we can all work to reduce our risk of heart attack. It's recommended that healthy people get 30 to 40 minutes of what we call moderately intense aerobic exercise most days of the week, so that's about 5 days a week. And moderately intense is something that you do continuously, either for 30 to 40 minutes at a time, or maybe breaking that down into 2 or 3 10 or 15-minute sessions during the day. And aerobic exercise means that you're continually moving. That could be walking, jogging, bicycling, doing water aerobics, really whatever you enjoy enough to make it a priority to happen every single day.
And remember that things like gardening, housekeeping, or taking the stairs all count toward your total. Next, be sure to eat a heart-healthy diet. Eating foods that are low in fat, cholesterol, and salt can help protect your heart. So can a diet rich in fruits, vegetables, whole grains, and low-fat dairy products. You can also try low-fat sources of protein and certain types of fish to reduce your risk of heart disease.
Previously, our efforts have educated people on fat choices, and it's still true that reducing what we call saturated fat in the diet is helpful because it decreases bad cholesterol levels and it also decreases calories. Foods that have saturated fat are mainly from animals, so highest saturated fat comes from red meat, full-fat dairy products, and not completely eliminating but reducing those and picking low-fat options when you can are very good choices. The worst kind of fat is called trans fat, and that's something that's added to processed foods that will increase the shelf life of those foods. It's almost a double whammy, if you will, because trans fat increases the bad cholesterol called LDL and at the same time decreases the good cholesterol called HDL.
Avoid deep-fried fast foods, bakery products, packaged snack foods, margarines, and crackers. Look at the label for the term partially hydrogenated to avoid trans fat. Heart-healthy eating isn't all about cutting back, though. Most people, for instance, need to add more fruits and vegetables to their diet, with a goal of 5 to 10 servings a day. Eating that many fruits and vegetables can not only help prevent heart disease, but may also help prevent cancer. There are some studies that show a glass of red wine is part of a heart-healthy diet. Red grapes are believed to be rich in an antioxidant called resveratrol. which protects the heart from disease. Dark chocolate with cacao content over 70% also contains resveratrol.
We have to be a little careful in medicine when we recommend or not recommend alcohol intake. But it is true that most studies suggest people who take a very minimal amount of alcohol are actually healthier than people who don't drink any at all, and obviously they're healthier than people who drink in excess. By definition, that generally means alcohol in moderation for women is considered no more than 1 serving per day, and 1 serving of wine is 4 ounces. For men, no more than 2 servings in any given day is the maximal recommendation.
Next on the list for optimal heart health is to maintain a healthy weight. One way to see if your weight is healthy is to calculate your body mass index, or BMI, which should be 25 or less. BMI considers your height and weight in determining whether you have a healthy or unhealthy percentage of body fat. A BMI of 25 or higher is associated with higher blood fats, higher blood pressure, and an increased risk of heart disease and stroke. Waist circumference is also a useful tool to measure how much abdominal fat you have. In general, men are considered overweight if their waist measurement is greater than 40 inches. Women, in general, are overweight if their waist measurement is greater than 35 inches.
A little bit of weight loss, or at least modest weight reduction on the order of 5 to 10 pounds, is incredibly beneficial metabolically. We never advise people to lose more than 5 or 10% of their total body weight in any given year, because otherwise it's likely to come back. But particularly in patients who are prone to diabetes, just losing 5 to 10 pounds over the course of 6 months can make a dramatic difference in their metabolic welfare.
It's also important to get regular health screenings. High blood pressure and high cholesterol can damage your heart and blood vessels. But without testing for them, you probably won't know whether you have these conditions.
Even people who feel exceptionally fit and healthy can have significant abnormalities that they may not be aware of that put them at increased risk for a heart attack. So at a minimum, people always need to be checked for a cholesterol level, a blood sugar test, and a blood pressure test to make sure none of those is significantly abnormal.
Heart disease is often avoidable. By finding ways to include heart-healthy habits into your lifestyle, you can enjoy a longer, healthier life.